Hi everyone. Well, I know that we must all have felt a real sense of dread when we heard the announcement at the weekend about the next national lockdown. And we're all still thinking about what this will mean for our families, our friends, our economy and of course our hospitals. Lockdown was hard enough last time, but of course we're concerned about what it'll be like for us now in the darker winter months when the NHS is traditionally under increased pressure. The very high numbers of people with COVID-19 in the community means that this virus continues to pose a significant threat to health, both nationally and locally. Given the time lag before these increased levels are felt within our hospitals, it's absolutely right that definitive action's taken now to address the situation. Our hospitals are already busier, with a significant number of COVID-positive patients on our wards, and as such, upsetting though it is, we need this lockdown to bring things back under control. As NHS staff, we're fortunate that we all have a clear sense of purpose during these uncertain and challenging times. We know that we're hugely valued by our local community, and we're clear that it's our job to maintain the essential NHS services that are so important to local people. As such, we have an extra duty to role model the right behaviours and do everything possible to prevent the further spread of infection. We're already testing frontline staff in high-risk areas in line with national guidance, and we expect to expand this further. We're also testing those patients with a planned procedure as well as those admitted as an emergency. But as NHS staff, we need to do more, and we all have a part to play. It's essential that we stay up to date with good practice and maintain good infection control practices at all times. This includes using the correct PPE and disposing of it in the right way. It also means maintaining strict social distancing, both inside and outside work. It's also really important that we don't come into work when we feel unwell. I know none of us wants to let our colleagues down, but this really is the right thing to do, particularly in the midst of a pandemic. So if you have symptoms like a new cough, fever, loss of sense of smell or taste, do please stay at home and arrange a test as soon as possible. In this way, we can properly protect each other. Looking ahead over the next few weeks, it is going to be tough to reinstate restrictions on visiting. We know how very hard this is for everyone, for the families and friends who desperately want to visit their loved ones, and for the staff who want to support them. I know that we'll continue to do all that we can to help people stay connected and in close communication with each other. For example, by allowing free phone calls from the bedside, by facilitating the use of FaceTime, or simply by sharing messages or packages. With such high levels of COVID-19 in the community, we have to restrict visitors in order to protect our patients and our staff. However, we'll continue to do this humanely and with compassion. It's also important that we recognise the extra work that this means for staff who really will need to go the extra mile again in order to help patients maintain communications with their loved ones. I know what a strain COVID-19 puts upon everyone working within the Trust, within our clinical teams and our supporting departments. I also know just how frustrated and sad we all feel in light of this further lockdown. We all need support to keep going during these very challenging times, and this support is available for everyone. Do please take advantage of this. Details are available on our intranet. So the more we can do now to protect ourselves and the NHS, working closely with our partners and local people, the better place we'll be for the future. Things will of course improve over the next few months with the expansion of very rapid testing and the rollout of the much anticipated vaccine. I know we'll get through this together, and in the meantime we mustn't lose heart. So in closing, I just want to say once again a big thank you to everyone for all that you do. I could not be more proud of our people, with the dedication and commitment of all our staff so evident across every ward and department within the Trust. It's a real privilege to work alongside you. Thanks.